Today is perhaps the most significant day in the 68-year history of this organization. Our organization was founded by members of the community who crafted a vision of a more modern healthcare facility that would meet the needs of a growing and evolving community. And that bold vision led us to what is now Baptist Hospital, which opened its doors in 1951. And that bold vision continues to guide us even today. For today, I am honored and excited to announce that Baptist Healthcare will be constructing a brand new state-of-the-art hospital and healthcare campus. This new campus we anticipate this campus to be over 650,000 square feet. We expect our investment to be well over $550 million. It will be located at the southwest corner of the intersection of Interstate 110 and Brent Lane. We're excited about this location because it keeps us close to our current campus while also creating more accessibility to the greater community. And we look forward to working with community partners, nonprofits, the faith community, the business community, elected officials, as we work together to reimagine our current E Street campus to better meet the needs of this community in the future. This is truly a win-win opportunity for our community. Now, we are just at the starting line. There is so much work to be done. We will enter into the planning phase, followed by the design and schematic phase. We'll work hand in hand with our regulatory bodies throughout this process. We expect construction to begin in approximately 1 year with a scheduled opening date in the summer of 2023. These are exciting times for our community. All the revitalization downtown, the Maritime Park, the new vision for waterfront, all the large and small employers flourishing in our community. These are indeed exciting times. And at Baptist Healthcare, it is an honor and is a privilege to be a part of these exciting times. This truly is a transformational investment and commitment for generations to come. Thank you again for being a part of this day. At this time, I'll invite Candy back up and we'll take a few questions. So the question was, how long have we known of plans to move to the new location? Have we had any CRA investment funds? First of all, we've not been able to benefit from any of those types of investment funds at this immediate campus. We went through an extensive planning process to evaluate how could we invest in this current location. And the conclusion was that we would have to invest hundreds of millions of dollars and still be left with a facility that won't meet the needs of the community itself today. So then we looked at option 2. How can we replace the hospital on the current site? Again, due to land limitations and the need to stay open while you build, it just was not a possibility. So then we looked at option 3. If we're going to have to move, where should that be? And we looked at many, many options throughout the community, in the Central Park, downtown, and the North End. We were, through research, it shared with us that if this was an economic decision, we would move far north toward the Pine Forest, Beulah area. But this is not an economic decision. This is a community decision. So we set about the task of trying to assemble attractive land that would keep us near our current campus and near our current community. So this has been a relatively recent decision. Work has been underway to cobble together a number of parcels to make up 50 acres at that southwest corner intersection. What's going to remain at the main campus? We are not sure yet. Here's what we are sure of. We are committed to this community, as we have been for 68 years. We want to sit at the table literally beginning tomorrow, where we're going to assemble a gathering of people from nonprofits and from social agencies, from businesses and the faith community. We're going to sit down and have this conversation and start the process. That's the starting line tomorrow as well, where we're going to look at what are the needs of 32501 and how can Baptist Healthcare be a partner in better serving those needs. Yes, do we plan to raise or utilize all these facilities? We don't know the answer to that question. That would be part of the planning, the design phase that we'll enter into. We don't think we'll need all of the current buildings. In fact, it would be very expensive to maintain and keep open. But we don't know the answer to that question. There might be some utilization that would benefit the community, but we'll explore those opportunities and options going forward. He asked, any new specialties, any new services? Right now, at this stage, we are planning to essentially replicate what we have in terms of capacity and services and offerings at the new campus. We do know that we have opportunities to expand needed services today. For example, we know we need more critical care access. We know we need more emergency department throughput. So we're going to evaluate that question. We don't have any specific new services we plan to offer at this point, but this new opportunity might very well raise those opportunities going forward. He was asking about certificate of need, which is a state regulatory requirement to get approval to add beds or remove beds. As you might know, in this year's legislative session, there was a bill sponsored and that passed that essentially eliminated certificate of need requirements for new hospital beds and new hospitals. That legislation actually was signed by the governor yesterday. However, and having said that, we have already informed the state agency that regulates healthcare of our intentions and that we commit to working with them, even though right now they don't believe and we don't believe that there's any certificate of need requirements. We stand ready to participate in that process if needed.
Thank you again, media, board members, officers, community leaders. Thank you so much for being here. We appreciate you.